I know a lot of parents do their best to try and avoid those kinds of triggers, but, if the worst happens and an attack starts occurring, what are the signs of an attack that really merits going to the emergency room?
Well, we always talk about kids and seeing can they count. And so a child with good air function can generally count to 10 on a single breath. A child who's having some difficulty can count to about 5. If you're having a child who has continuous coughing, can't count to 3 without taking another breath, is clutching their chest, drops their activity significantly, just essentially wants to sit down and breathe. Those are all signs that the child needs to be seen. Obviously, those are the more extreme ones. Even children who just can't seem to settle down. Sometimes the asthma, although they're having a hard time breathing, gets them revved up. It gets them in a state of anxiety where they just sort of pace, but they're pacing and coughing at the same time. Then they have to sit down. Then they get up and pace again. So a sign of distress, a sign of anxiety, and the difficulty breathing, those are generally all signs the child is in respiratory distress and really should be seen in the emergency room.
I think we don't like to think about it that way, but are there things that parents do that perhaps they should be avoiding that could send their child into an asthma attack?
Well, as I said, smoking is really key, trying to avoid that. We all go for that lovely fireplace and fire in the middle of Christmas time, and taking care of it can be a problem. Fragrances. So moms who wear a lot of perfume, or dads that wear a lot of cologne, those fragrances can be a significant trigger. And so being careful is really the big thing, trying to keep the room clean. If you just can't get rid of Fido, or you can't get rid of Kitty, just keeping the pet out of the room, and so that you try to keep an area of a sanctuary almost, to try to keep the air clear. So trying to avoid too much exposure. It's great to have kids be outside and playing, but not while the grass is being cut, both for safety reasons, but also just bringing up those allergens in the air. Just doesn't cut grass, brings all the molds and all the pollens that have been settled down in the ground, brings those back up in the air. And those can be triggers for these kids as well. So trying to keep these kids somewhat isolated, but not totally isolated from the world.